Hi, I'm Deb. I'm a physiotherapist from Move Better for Life, and this is your 113 awkward amount of time segment. And we are talking about acute lower back pain today. And it's something that most of us will experience at some point in our lives. Mostly, we'll get over it, but for some people, they don't, and it keeps returning. So it's important to understand what it is that leads to lower back pain. Firstly, it's generally excess stresses and strains on the discs and soft tissues around the lumbar vertebra. And the triggers for it can be anything such as prolonged sitting or repeated bending and twisting. And it'll be activities such as going on a long journey where you're sitting for long periods of time in a car, or moving house where you're doing a lot of repeated bending, digging in the garden where you're doing bending and twisting. So it's good to try and identify those things. And that's one of the first things that you can do to start trying to help yourself, identifying what it is that led to this. Now, just be aware that normal healing times are about 6 weeks, but that will be prolonged if you are older or if you've got some comorbidities or secondary health issues. Secondly, what you can do is take some anti-inflammatories. Now, if you do have other health issues, it's important to seek medical advice from your doctor about whether you should be taking anti-inflammatories, but generally, taking these in the first week can be really helpful and help you get over the pain more easily. And then thirdly, you can do some exercises. So there's many exercises you can do. I'm going to tell you about 2. Firstly, pelvic tilts, where you lie on your back with your knees bent, your feet flat on the floor, and you draw your belly button in towards your spine. You flatten your back against the mat or the floor, and then you arch. So you're just flattening and arching your back slowly and gently to get some movement in the lumbar spine. Secondly, the next exercise is called a press-up extension. Sometimes people call it McKenzie exercise. You lie on your tummy with your elbows bent and your hands on the floor just next to your shoulders. Then you push up, straightening your elbows. You push up, straighten your arms. Your chest rises off the floor. You keep your hips on the floor, and then you slowly lower yourself down. So it's gently lifting your chest up and then lowering it. And that can be, those 2 exercises together, particularly in the first stages of acute lower back pain, can be really helpful. So thanks for listening to this 1:13 p.m. awkward amount of time segment, and I'll see you next time. Thanks. Bye.